Are you fearful of the dentist? Do you have dental phobias, apprehension? Are you one of those individuals, or you've heard people who say, I hate the dentist. I hate the dentist. Well, one of the reasons why they hate the dentist is because of having to get numb, right? Maybe scared of the needle or just whatever that phobia is. Well, today we're going to talk to a dental student who just matched into dental anesthesia. Yes, dental anesthesia, which is like the sleep dentists. We're sleep dentists, right? We have the solutions to successfully making sure that we can help you conquer that apprehension. And she's going to tell us all about how she matched into the program. She's going to also tell us about how she put together her application, how she ranked her program, how she did her interviews, all that and more. So stay tuned. Hey, this is Dr. Darwin, a new dentist coach, for another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Be sure you're continuing to share this content, comment, save it for later, go back, use it as part of your process to get into residency. Also, this episode is being brought to you by GetIntoDentalResidencyChallenge.com, the ultimate resource to help you jumpstart your application process for residency. For more details, go to the link down below, okay? And join the next challenge. Today, we're talking with special guest who is recently successfully just matched into probably one of the well, it is definitely the one of the newest dental specialties, but also one of the dental specialties that's very, very competitive. Today, we're joined with student Dr. Sydyne Fields, who's on the countdown. She's got two countdowns. She's got completion of dental school as a countdown, but she also has a countdown into launching her career as a dental anesthesiologist. Doc, how you doing today?
I'm good. How are you? Thank you for having me.
I'm fine. I'm great. I'm great. Please tell us a little bit more about yourself for those that may be meeting you for the first time as well.
Yes, sir. So my name is Sydyne Fields. I'm from Houston, Texas. I'm a fourth year dental student currently at the Woody L. Hunt Texas Tech School of Dental Medicine. My dental school was a brand new dental school that just opened in 2021, and I will be a member of the first graduating class. So the inaugural class here at Tech. I was a former college volleyball player. I attended the University of North Carolina at Chapel Hill for 3 years, and I played volleyball there for 3 years. And then I ended up transferring my junior year to Texas A&M, and I completed my collegiate career playing at Texas A&M. I studied chemistry and Spanish, and I graduated in 2015. Wait, did I graduate in 2015? 2019, sorry. I graduated high school in 2015, 2019. I hope you can edit that out.
Yeah, yeah. Hey, I get it. You know, as a volleyball player, jumping up and down, your brain is moving, going left and right. You can't remember some of the things. I get it. Same thing happened to me running track at college. I get it. I don't remember everything. So H-Town, Houston.
Yes, sir.
Oh, awesome. Lived there for a while. Love Houston. And UNC, I went to UVA, ACC rivals.
Okay.
So that's great. That's great. Outside of that, the only other thing we have in common is Spanish. Yo hablo español solamente un poquito, but chemistry, nah. Can't say we have that in common. But that's great, Doc. That's great. So let's dive in. Let's first talk a little bit about dentistry. Why'd you pick dentistry as a student athlete majoring in chemistry?
So I knew I wanted to be a dentist ever since I was about 7 years old. Living in Charlotte, I moved to Houston when I was 10 and I grew up in Charlotte originally. And I hated going to the pediatrician because I always had to get shots as a kid. But I loved going to the dentist. I really enjoyed going there. I really looked up to my dentist. I always got to get toys from the toy chest and stickers, and I was always told that I was a great patient. So I just had a really positive experience there. And as a young child, that was being influenced. I was very impressionable, and I knew I wanted to have a job where I could help people. So I decided to pursue dentistry. I attended UNC because they had a dental school on their campus, and I wanted to go to college where there was a dental school connected to the campus, so I could be involved throughout undergrad. And then also there was, their volleyball team at the time was on the rise, consistently ranked in the top 25, competing in the ACC for ACC championships. Going to the NCAA tournament and going to the Elite Eight. So that was something that was intriguing to me for why I decided to do dentistry and attend there for undergrad initially.
Gotcha. So you got there, got to undergrad, and then went to dental school, and then decided to specialize. So let's talk about that because there are many different specialties, right? But there's also specialties that are competitive, and there are also specialties that maybe you may not be interested in, right? Maybe you didn't necessarily like a lot of lab work, for example, like cross or something like that, where you would be doing a lot of that as a specialist. Tell us how you and why you picked anesthesia.
So initially, I came to dental school thinking that I wanted to be an orthodontist, actually. When I moved to Houston, I was told that I should start modeling. I'm 6'3", as a fun fact, for those who are watching the podcast. So my teeth weren't straight. And so before I could get my portfolio pictures done, I had to get ortho. And I loved braces. I thought it was the coolest thing ever. I never wanted to get my braces off. And so I figured that I knew that I would want to go into orthodontics once I started dental school. And shortly after my time in dental school, I realized that that actually wasn't going to be the best career path for me. And so I learned about anesthesia initially in our pediatrics course when we were learning about nitrous oxide and different methods of sedation, light sedation, moderate sedation, deep sedation. And it was kind of intriguing to me just because I feel like some of the pharmacology with the drugs was more similar to some of the chemistry that I had spent a long time studying in college. We study a lot of microbiology and organisms and how they affect the oral biome. And so like that was a little bit different than what we had been studying in our other classes. And that was like what initially intrigued me. So I went to go shadow a dentist anesthesiologist for the first time out in LA. And when I was there, there was a patient that was being seen that day that had dental phobia. And they wanted to be sedated for their dental work. They were getting crowns done. And then there was also a patient there that was a special needs patient. And so at my time shadowing there, I kind of realized about the fact that DAs provide a service that's very special to a very critical population. And I never had thought about how people who have special needs get dental work done before. And so that was something that I really appreciated about the field because I think it's extremely important. And then besides that, I think just the academic challenge of it. It's very critical to consider the physiologic changes and differences that occur in younger patients versus older patients, and having the knowledge to be able to deliver individualized patient care for those patients. And so that also intrigued me. And then I think just like the lifestyle balance and having good work-life balance with the career for my future plans, hopefully as a mother, that was also like a perk. So yeah, when I just thought about everything, I felt like also my personality have a strong background as a leader from being a captain and playing in college. I've been involved in many different student organizations on my time here at Texas Tech. So I think it just worked well for who I am as a person.
That's a great story of one of which, for those that are listening and watching, you will have to procure your story as well, and telling why a specialty, in this case, why anesthesia. So let's talk about the application, because it's a little bit different in the sense that for some specialties there are what we call some entrance examinations, like for ortho. It's recommended usually GRE,
Mhm.
endo. There are some programs that they want you to take the ADAP or surgery, and dental anesthesia have something in common, which is the CBSE, right? So I know that's going to be part of your preparations, but let's talk about that because there was a time, and I'm not sure. Maybe you can share with us. What year did you determine, all right, it's not ortho anymore, but it's anesthesia? Because knowing when that timeline is will also tell us a little bit more about how you prepared your application to be able to apply D3 year or D4 year, right? So tell us about those application preparations and strategies as well.
I would say probably by the beginning of my second year, I decided that I wasn't going to be doing ortho anymore. And so as far as preparation, one thing that I did was attending the ASDA conference every year, which is the American Society of Dentist Anesthesiologists. And going to the conference was a way for me to connect with current residents, program directors, meet them, ask questions, learn about their programs, learn about the differences, learn about their strengths. And so that was when I was there, I was talking with the residents about the entrance exam, the CBSE. And so luckily, Texas Tech, my school, is a part of a health sciences center, and we have a medical school here on campus. And I have colleagues in the Texas Tech Medical School that shared their resources with me that they use to study for their exams, and also what they were using to study for their USMLE boards. So I got to studying. The CBSE is only offered twice a year. It's only offered in February and July, and you can enroll to take the exam through ASDA, which is the American Society of Dentist Anesthesiologists, or you can also enroll through the Oral Surgery Society. And if you enroll through ASDA, you get a 2-week window where you can schedule your exam at the Prometric Testing Center. If you enroll through the Society of Oral Surgeons, then there's one testing date that they give to you, and you have to take the test on that day. It doesn't matter who you enroll with, you just have to enroll with one or the other and take the test and get the score. So I pretty much used all medical school resources. I studied for about a year and a half total time, I would say. I took the exam twice, once in February and then again in July, leading up to my application cycle, which was, of course, my third year of dental school. And I just took the exam twice because I wanted to give myself the best chance. I wanted to score as best as I could. I felt like my first score wasn't representative of the knowledge that I actually knew. And so I decided to take it again. And I used mainly UWorld as a resource for those who are listening and trying to figure out a path to navigate that test. It's a question bank that kind of simulates questions that you would find on the CBSE. I also used Pathoma to study pathology, and I used Sketchy for microbiology and pharmacology. I also had a first aid book that I carried around with me everywhere religiously, like a Bible. And I took notes in my first aid book. I took notes from Pathoma on my iPad. And then when I was getting closer to test day, I used the NBME forms, which are essentially old CBSE exams that were administered. I think right now there's up to form number 31. The higher the number form is closer to an exam that was just given. So I started off with like forms like 7, 8, 9, and then I worked my way up to the higher forms to practice time and simulate the actual test setting.
So what you just shared with us was just a whole playlist or a playbook on how to study and really prepare your application more specifically for taking that exam because that exam is key, right? It's key because not only are the positions very limited in anesthesia, right? 34, 35 positions, 10 schools in that, including one that's in Canada and North America total, 10 programs, very competitive. So that score is key,
Yes, sir.
key. What's typically, or what did you find was the range scores need to be in based on what maybe residents shared with you, maybe information that you got at the ASDA conference, and what was your target?
That's a great question. For medical students, they take the CBSE exam before they're allowed to enroll for the USMLE. USMLE is a pass fail exam. CBSE is a scored exam. For medical students to get clearance from their med school to enroll in their boards, they have to score 60. A 60 is considered passing. That was my goal, to shoot for a 60 to consider to pass the exam. I had a friend here at Texas Tech that took the CBSE and she didn't score 60, so the school did not grant her access to enroll in the step one board. So that was what I was scoring for. I would say to be a competitive applicant, passing would be great, or if you could even score in the 70s, which is pretty typical of OMFS residents, like that's also good. The exam is fairly new as a requirement for anesthesia applicants, so the scores are very variable and it does fluctuate. I think if you don't score 60, that's okay. But I think that ideally is like a good competitive score to be able to pass that exam as a dental student. I think another really important part of the application process, besides that exam, since it is scored, is externing with the programs. That's a way for you to like learn the program, learn the residents, learn the program director, learn what they're all about, but also for them to meet you and learn you and know who you are as a person, how well you work with the team, and if you would fit in at that hospital and if you would fit in, working with those residents because you do work very closely with these people for 3 years. And so as far as my application went, planning in advance enough time to allot myself to be able to complete all of the externships at every program that I applied to was really important because, of course, I'm still a dental student. I still have requirements at dental school that I have to fulfill. I can't be missing all of these days. So planning in advance and planning strategically to complete that, I think is also a really important part of the application because some programs, if you don't extern at their program, they think that you're maybe not that serious about the program or you're just applying willy-nilly to see like, hey, let me try to see if I can get into this. So I think it shows determination and it shows, that you really are wanting to do this. Externing is also a really important part of the application process. It starts before your application even opens, but it is still a part of the process.
Yeah, I was going to say, I mean, to be able to coordinate those externships, right, is a process in itself,
Yeah.
outside and internal to the overall application process. What's the best way for people to contact you?
They could email me. I'll give my personal email since I won't be graduating or I'll be graduating from school. I won't have my Texas Tech email. So it's just my name, Sydyne, spelled SYDNYEF, as in Frank, at gmail.com. My name is spelled very uniquely. So it's not Sydyne EY, it's Sydyne YE. And then I've also just had a lot of people reach out to me and message me on Instagram. I'm pretty active on there. My name currently is Sid Fills, SYDFILLS. In May, when I graduate, I'll be changing my name to Sedation, so it won't be Sid Fills anymore. But yeah, I would say email or Instagram is fine. I have responded to everyone that's reached out or tried to. If there's someone that DM me and I didn't answer, please message me again. But yeah, I think like I'm very passionate about pre-dental students and like just helping people in general because I feel like when I applied to dental school, I didn't necessarily have that. I didn't know a lot about dental school. I didn't really know what I was doing besides pre-dental society and our volleyball team advisor who was just like, these are the prerequisite courses, girl. Like, that's all I can tell you. And
Right.
so I just aspire to be the person that I wish I had. And so whether that's for dental school or for residency for anesthesia, I had a lot of great advice from my future co-resident. But I also just reached out to him on Instagram and I was like, hey, can I ask you some questions? So I think
Yeah.
that's why I go so hard is just because I want to help people and everybody can reach their dreams. And if I'm able to be a part of that process, then that's amazing. So.
That's right. Well, you are part of the process. You're doing it and you're helping people right now who listened and who probably need to do two things. Number one, go back and listen, supplement your notes with all this good information and value that Dr. Fields have shared with us. And then the second thing is go to the next episode. Go to the next episode right now. Go, go.